Local health leaders say they are bracing for another possible surge in COVID-19 cases as the Delta variant spreads across the nation. Ballad Health is reporting 46 patients in their hospitals right now with COVID-19. That's up from 27 patients as recently as June 30th. 13 of the patients are being treated in intensive care units, and 8 of them are needing the help of a ventilator to breathe after they were down to just 1 patient on a ventilator June 30th. Ballad Health Chief Infection Prevention Officer Jamie Swift joins us tonight. Jamie, your reaction to the numbers, clearly not in the direction you're hoping to see them.
That's right, Josh. Obviously, I'm concerned. We're starting to see what is very much the impact of Delta. I believe the early impact. I think things will most likely get worse from here. We're trending in the wrong direction. And certainly, we are not where we were in December and January. We don't expect to get back there. But to double as quickly as we have is extremely concerning.
Jamie, first, for those of us who are trying to catch up here, what is the Delta variant? It's still COVID-19, but a variant of it, and why is it so concerning?
It is COVID-19. It will still show positive on a COVID test. There's no special test that you need to request. It's a variant. We know that viruses continue to emerge and do their best to have various variants that will continue to survive. And so what we know about Delta is that it is much more contagious. We are seeing a higher hospitalization rate, as you can see by our numbers, and the R0, or how many people get infected from one case of Delta variant, is much higher than the original strain, and that's what's concerning.
I know that you are closely watching the number of patients in your hospitals that have received the vaccine to see if, in fact, the vaccine is effective. Based on what you are seeing, what can you say to the effectiveness of the COVID-19 vaccine against the Delta variant?
So it's really important that people hear that the Delta variant is the vaccine is very effective at keeping people from developing severe illness, ending up in the hospital, or death. We're not seeing, for the most part, fully vaccinated people in our hospitals. There seems to be a little bit less protection of infection, but if you do get infected with Delta variant after full vaccination, you're having a much milder case. It's very similar to those people who have flu shot and then get flu and have a very mild illness.
What about the idea of a booster? I imagine there are some people who are very concerned about COVID, who've gotten vaccinated, and they're feeling great about things, and now they hear this variant coming through that's more virulent. I know we are not cleared for a booster. There's no recommendation for a booster, but can you see that as potentially coming? And what would you say to those tonight who are thinking, you know what, I think I'm going to go out and get another vaccine just to be sure? What's the message to them?
It's hard to speculate. Certainly, we're following the science, we're following the data, and we'll continue to do that. And if and when that time comes that boosters are recommended, hopefully we'll be in a position that we can help the community achieve that.
We're not there yet, though. There is no booster out there. There's no recommendation for a booster at this point, right?
There is not. People that are fully vaccinated really need to be comfortable in the fact that they are protected from that severe illness and hospitalization. If you're not fully vaccinated, now is certainly the time to do that.
We've heard the saying, this is a pandemic now of the unvaccinated. That we are mostly looking at people who are getting COVID now and who are being hospitalized with COVID who have not gotten the vaccine. Are you still seeing that's true? And tell me about your patient population in terms of age and also those pre-existing medical conditions. Is it looking the same as it did when we were before seeing high numbers?
Pandemic of the unvaccinated certainly is making its way around. I struggle with that term a little. So while it's obviously true, we have to remember that encompasses a lot of people who are not eligible for vaccine. So all of our children under 12 are not eligible for vaccine. A pandemic of the unvaccinated is a pandemic for all, because your healthcare workers are still responding to that pandemic. There's still community measures in place. As more and more transmission occurs, that leads to more variants. And so it really is, I understand the meaning behind that phrase, but it's also, you don't want to get too comfortable in that, because we truly are all still in the middle of a pandemic. Our patients, as we've shared, the average age of our patient has decreased, and so I think we're still, for average age is certainly around 60, and that's down from where we were in the height of the pandemic. It's going down. I can tell you our cases that we're working that are tested through Ballad Health are much younger. We're seeing about 70% of our cases that were tested just yesterday were under the age of 40 that were positive.
Wow. All right. Jamie Swift at Ballad Health, thank you for your time as always. We appreciate it. Sarah?
Thanks.